Hi, I'm Dr. Malti, the founder of Ayur Integrative Medicine. I'm an integrative medicine expert, and today I'm going to share my story of why I became an integrative physician and why I launched Ayur Integrative Medicine and started my own practice. For the first 10 years of my career, I worked in the hospital. I then switched over to become a primary care doctor. At the time that I switched over to primary care, I had a younger panel of patients um, who had empaneled with me. And many times I would hear them asking me, Doctor, we don't like to take medications. Is there anything we can do naturally, or is there anything that we can change in our diet to help with this condition? For example, um, you know, if they had a foot strain, or um, they had they had some low back pain, and I would tell them to take ibuprofen or naproxen. They would tell me, Doctor, is there anything I can do naturally to help with this? Um, I didn't have much answers for them at that time. Yes, I would I would talk to them about diet, I would talk to them about exercise, but I really did not have good answers to the question. And I kept hearing this again and again and again. And I said, I really need to look into this because this is something my patients are asking. I did a lot of research and I found this fellowship in integrative medicine at the Andrew Weil Center for Integrative Medicine. Now, integrative medicine is is a type of medicine that combines conventional Western medicine with treatments from other systems, as well as natural treatments in an intelligent as well as in an evidence informed way to maximize the health benefit for the person and minimize the harm. So I joined this fellowship, and as I went through the fellowship, as I was going through the units, and learning in the material, I started adopting one practice from each of the unit I was studying. For example, one of the earliest units was delved into spirituality and the role of spirituality in health, and it talked about prayer meditation. And one of the I chose an op you know I chose and one of the things I started practicing was a prayer. And this was the time when the COVID pandemic started, and there was so much anxiety, there was so much fear in me, in the people around me, in the patients that I was treating. And this prayer meditation and the sympathetic stimulation that prayer and meditation brings about gave me a lot of calmness. Then came a chapter on nutrition, and I just made 3 or 4 changes based on what I studied, to the way we cook and eat food in my house. The next chapter was on yoga and Tai Chi and movement and exercise, and I started learning yoga and I started practicing yoga for 2 hours a week. A few chapters down, we learned about the power of nature and connecting with nature. And, I started making it a point to go out for a walk every evening, to be out in the open air in nature, rather than just exercising on a machine at home. I started, growing house plants. And I would, in the evening, I would, when I came back from a very hard day of work, I would sit with my cup of coffee near the house plant. And that would give me a lot of calmness. Nature has its power on us, on us, and in stimulating our healing. So by the time I finished the fellowship, I was convinced that this is the right way to practice medicine. and I was not finding any joy and meaning in the way I was practicing medicine. What I learned in the fellowship and more importantly, what I practiced because of what I learned in the fellowship helped me prevent burnout, because it was very important for me to be present for my patients during that difficult time. And if there is one thing that helped me, it's all these integrative practices that I put in place for myself. I had to be present for my patients, I had to be present for my family, and these integrative modalities are what helped me survive. So I am dedicated to give this back to people, to busy professionals like me, people with chronic conditions. I'm determined to give this back to the community. This is why I practice integrative medicine.